when someone is vaccinated, are they sort of, how quickly does that immunity build up in them? I'll put that to either. Diane, why don't we?
They say it takes about 2 weeks after you receive that flu vaccination for it to build up enough steam, enough strength in your system to actually fight off that flu virus.
Okay. So I guess, the chances, there's also a possibility that for folks who feel like they just got the flu after they got the flu vaccine, there is a window, right, where they may have been exposed to the illness, and even though they were vaccinated, they weren't quite fully prepared yet for that.
Correct.
Okay. Now, is there anyone in particular who you would say should not get the flu vaccine? Diane, when folks come to the clinics, is it, and I know you also just do adults, is that correct?
That's
you vaccinate
right, at
adults?
our clinics, right,
okay,
over 18.
Okay.
We advise people not to get the flu vaccine if they're allergic to chicken eggs or egg products.
Okay.
People who've had a flu shot and had a severe reaction to that, flu shot prior.
Okay.
So if you've reacted to a flu shot, you probably shouldn't get another one.
Okay. Now, what is the egg allergy connection?
Well, I guess the vaccine is grown in the egg.
Okay.
So it is in contact with egg products. So if you're allergic, and now I go ahead and give you that product, you're going to react.
Okay, got it. And then folks who have had a reaction in the past.
And people come in and they say, well, I have a little bit of a cold, a little fever, I'm not feeling real good. Well, perhaps those people want to put off getting their flu vaccine just for a few days, let that fever run its course, make their bodies feel a little better, and then come on back to one of the clinics and get their flu vaccine. So, if it's something minor, well, I have a little runny nose, that's probably fine to go ahead and get your flu vaccine that day.
Okay.
But if it's anything a little more than that with some fever, perhaps you should just wait a few days and get that shot when you're feeling better.
Okay. Now, is pregnancy a contraindication for someone? If a woman is pregnant, can she still receive the flu vaccine, or does it depend on where she is?
I think the gynecologists are now recommending if you're going to be pregnant during flu season, that you probably should have your flu vaccine.
Okay.
But each provider might be a little different with that, so you're best to check with your obstetrician.
Okay, great. Now, we know that the nasal spray, of course, if we're speaking vaccinations, is another option. Robert, is that something that your pharmacy offers, or how would folks find out about that?
That's something that they would check with their individual health care provider regarding. Most of vaccinated patients at the store go with the injection itself and not the nasal spray.
Okay.
But it is available as an alternative.
Okay. Robert, you alluded to some of the things we need to think about in terms of prevention. I mean, vaccination is something that public health agencies have always recommended as a kind of an across-the-board way of protecting folks. And actually, I think I'll back up for one moment before we move into prevention. Flu clinics at through each of your departments and organizations, how would someone find out about it? Robert, why don't we start with you? How would
they can go on the website of the pharmacy, which is mydevines.com.
mydevines.com, okay.
And there's a link there for special programs, and they can click a link, and certainly they'll have information regarding the flu vaccination.
Okay. And is Medicare accepted, which is typically the case?
Right. Medicare, where there's no charge for anyone having Medicare.
Okay.
Part B.
Part B, right.
Right.
Okay. And others who don't have Medicare?
It'll be a $25.
It's just $25. Right. Okay. And is that about the same for yours as well?
It's the same, right. And if you're looking for a flu clinic in the area, you can go on the community health website. Okay. And also we have a phone number. You could call us and we'll give you a list of local flu clinics in your area.
Great. Okay. And I think I'll take a moment to also note that the Middle-Brook Regional Health Commission is offering 3 flu vaccination clinics this year. And they will certainly be posted on our website at middlebrookshealth.org. But just for those who live in the 6 towns that were mentioned earlier that we serve, they'll be beginning, most of them really, the 3 clinics are being held November 5th and November 6th in the towns of Middlesex, Bound and Warren Township. So the details of that will also be posted on our website, as well as links to each of your organizations as well. Can we talk a little bit about prevention here? And while vaccine, as I started to say earlier, vaccination is one option, what are some of the other things we would typically recommend for someone during flu season, during heightened cold season, to help reduce the risks of infection? Want to start here, Robert?
You want to avoid close contact.
Okay.
If you're sick, You want to make sure you stay home from work or school. I know it's
Mm-hmm.
very challenging, it's very difficult to do, but
Sure
if
is.
you limit time, you limit your contact with others, you're doing yourself a favor by not infecting anyone in your workplace or at the
Right.
school, as well as allow you to recuperate better.
Right.
The other thing you want to make sure you do is make sure you cover your mouth, you cover your nose, prevention. Every time you cough or sneeze, wash your hands.
Yes.
It's very key. Avoid touching your eyes, nose, and mouth with your fingers, because a lot of times you'll get an infection in the eye, conjunctivitis, or having bacteria, just through the normal course of things, as well as practice good health habits. Nutrition, eat healthy, take your vitamins.
Right.
Drink plenty of fluids, get your sleep, do the same amount of exercise you've always had.
Right. These are just basic common sense things, right? But we all, I think, are so used to running ourselves down that we forget to take these very simple precautions. You know, for those folks who take it to the end and they take care of themselves and they're getting vaccinated, but still sometimes infections happen in spite of that. I'd like to touch on something, Robert, that you mentioned earlier, speaking about the flu and colds as a virus, as opposed to bacteria. Now, if a person is officially diagnosed with the flu from their healthcare provider, what are the typical medications that are prescribed? And you would see that, I guess, most often, Robert, through your pharmacy. How are they typically treated?
Well, depending upon what additional symptoms they might have.
Okay.
Generally speaking, you certainly would treat body ache or fever by Tylenol, pain reliever.
Okay.
And if it's along with a cough, you'd find out whether it's a dry or wet cough, and then suggest appropriate cough medication regarding it. And you might even have a touch of a little cold too, with a runny nose. They're so close, and sometimes their symptoms are so
overlapping?
Exactly. That you try to make sure that you try to pinpoint as much as you can to be exactly the symptoms they might be having.
Okay. Now, you know, one of the things that I'd like to share, and we will post this on our website, I'll even hold this up. It's a brochure that comes from the Centers for Disease Control. And one of the, of course, the very current issue is the concern about antibiotic resistance. As you mentioned, influenza and colds are viral illnesses, not bacteria. Yet, as a parent, you know, and Diane, we were speaking on this earlier, we want to do something for our child, but what is the concern with antibiotics when it's not, in fact, a bacterial illness?
Well, you're always concerned about the overuse of antibiotics. If the situation doesn't require an antibiotic and one is just prescribed to make someone pleased that they've made a visit to their health care provider and it's not really indicated essentially, now you run into the situation where you might be resistant to antibiotics in the future.
Okay.
And therefore, things that would work previously don't work now.
Right.
And then through that also, the bacteria tends to mutate to get resistant. So then actually now breeding a whole new strain of bacteria, like a super bacteria. And sometimes our antibiotic technology and our research can't keep up with that. That's why you have some of these infections that are available now that are resistant to any antibiotics, and it's much of a challenge to try to help the patient.
To try to treat them. You know, and in fact, we had a program early on, several months back, about MRSA and methicillin-resistant stuff, or exactly that issue, and just how common that's becoming, with the belief being this is antibiotic resistance. They're getting smarter and smarter. I'll just remind folks that we'll have this brochure on our website, and this one is specifically for parents. So one of the points we really want to get across is that although you want to give your child something, or you feel as though you need to take some medication, I guess with the flu, really, we just have to ride it out. Is that?
Treat the symptoms, get some extra rest, lots of fluids, and rest. It's a big part. Nutrition, like you touched on before, Tylenol for aches and pains, and you know, sometimes that fever just kind of helps to burn off that germ.